Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. Today's going to be such a fun episode. We were talking, my name is Patrick. It's an Irish name. I've got an awesome Irish guest on today coming from Ireland. Lisa Grogan, say hello to everyone.
Hello, and it is an absolute honor to be here.
We're fortunate to have you here. Thanks for taking the time. It's 2:00 in the afternoon here. I have no idea what time it is your time, but I'm sure it's a little off hour. So thanks for taking the time.
Yeah, we're going on 9:00, but it's worth it to be here.
Hey, yeah, website's lisagrogandentalcoach.com. I think people from that understand what you do. That's great marketing, right? Have it in your name, what you do. I think that's terrific. Lisa, tell me, how'd you get involved in working with and coaching dentists?
Yes, so I'm in the dental industry nearly 2 decades. I kind of fell into it by chance, set up a clinic with a dentist that moved back from the UK to Ireland and just really fell in love with the industry. He was very interesting and he had a great business mind, but he really brought cosmetic dentistry to Ireland. And I suppose you got to see a lot of the big cases and the life-changing stuff that happened. So I was hard to step away from it after that. So from there, I went on to managing a group of 26 clinics around Ireland, and then I'm managing a dental medical device company. And about a year and a half ago, I decided to make the brave and bold move to step out on my own. I actually am qualified in psychology and coaching for like 5 years now. So I amalgamated the skill set with the experience, and a dental coach was born.
That's awesome. I have to ask this question because some things are the same. There's different rules, laws. Canada is very different than the US. Australia is incredibly different than the US, and what can be advertised, what can be done, said, what have you in dentistry. But some things are the same no matter where you go. I know you've spent some time in the United States, traveled all over. What are some things that you see, some problems that you see, challenges that are the same no matter where you go on this planet in dentistry?
Oh, challenges. Okay. You could go down a lot of rabbit holes here. One of the biggest things I see, and it makes me sad, is dentists undervaluing themselves. And where you can really see that is in pricing. And, the cost of everything have gone up, but a lot of people that I work with kind of don't really feel it's right to up their prices. But I mean, it's really leave the profit margin very, very tight. And a lot of dentists are saying to me that their revenue isn't reflected in their efforts at the end of the month. And that's, dentistry can be really rewarding, but it can be very stressful too. So we need to make sure that, they have that peace of mind when they go home. They can enjoy life outside the clinic. They know what they have in the clinic so they can reinvest in their business. So it's really, that self-worth piece is interesting.
Yeah, that's awesome. So what do you think the number one reason why dentists are undercharging or not requesting higher fees from their patients?
I think a lot of dentists are very heart-centered and they want to do the best for their patients. I think it really, really comes down to that. They don't want to be seen, I suppose, as, salesy or any that kind of stuff. And that can be a barrier in some sense as well, because you have to remember they're in the solution business, but not the sales business. And often there's a very thin line that can get blurred. And, conversations tend to not often happen with patients because dentists don't want to be seen as upselling or whatever way you want to phrase it. So that's an interesting one that seems to seep into many areas. But I keep reminding them, you're in the solution business, there's so much you can offer. Like, even patients come in for a checkup, there's loads of them that want the work done. Patients get nervous, right? So they come into the clinic thinking, I must ask about A, B, and C, and then the nerves get the better of them and they go out the door. So it's really up to the dentist to kind of open up these conversations. And there's lovely, safe, ethical ways like smile assessment forms are a fantastic way for them to do that. Really bridges the gap between what the patient wants and then saves the dentist having any awkward questions and highlights all the offerings within the clinic.
Smile assessment form. I love this. What does that look like?
So some people call it like a smile wish form. It's a lovely little form, and it's the thing I love about this, Patrick, is it's a free form. I have a free one on my website, or anybody can download it and make it up. And it generated our clinic absolute thousands. And it can be really simple and in layman's terms, no complicated language like, do you not like the black line above your crown? Do you feel like you have a missing tooth when you smile in photos? Like, you're really hitting in on the particular pain points that the patient has. It's not vague or fluffy. It's not like, do you want a nicer smile? Who doesn't want a nicer smile? But it really, again, uncovers what a patient, gets them thinking about, yeah, actually, I would like to improve this, and it brings it to the forefront of the mind when they come into the clinic as well, of things that they can do to change.
Fantastic. What's the flip side of that? Like, so there's always somebody that's like skeptical or worried or says, here's the problem with doing the smile assessment form. What is that? What's the opposition? What's kind of the challenge that you'll hear from dentists when you're talking about them?
The biggest challenge I get is I haven't got the time. And I know we can all be guilty of saying that, but that little questionnaire could literally just take 3 minutes, 3 to 5 minutes if done properly. And honestly, the amount of revenue it can generate, because you're just opening up these lovely conversations with patients. And even maybe if the dentist doesn't have time, maybe the receptionist can hand it when the patient comes in and take a quick note of things that they've ticked. And do you know where else it comes in really handy is, say, for example, there's like, do you want to find out about invisible teeth straightening? And the patient ticks yes. When a dentist decides to do an open day, they'll have a pipeline of people ready to contact with whatever, if they want to do an offer or add some added value, whatever it is. So there's loads of really positive reasons to introduce this free little resource. I honestly can't recommend it enough. And you know what it complements really well is a scanner. Because again, it opens up the conversations, and patients are visual, right? This is one of the biggest things about case acceptance is patients need to see the outcome. When we're spending a lot of money, what's the emotion that's attached to it? Bit of fear, right? We want to see that security. So to have stuff like the assessment form and visuals just helps, again, gets everybody on the same wavelength, that the patient knows what they want and the dentist is very clear about it as well. So it just stops any awkward conversations happening down the line.
Yep. I see in case acceptance a lot of times that dentists are thinking for the patient, especially when it comes to finances, right? So they're qualifying the patient, deciding, is this worth it? Do they have the money? And usually the equation they come to in their own heads is no, they don't, but they literally don't have any idea the resources of that patient, right? So if you had Bill Gates in your chair, right, and you clearly saw, oh, they need a crown, you'd have no problems telling them you need a crown is $2,000, right? Whatever the number is, no problem whatsoever. But a lot of people go, well, can they afford it? I don't know that they can afford it. Their sneakers look kind of tired or beat up, but you literally have no idea of the resources that particular patient has. How do you get over that? Like, how do you teach that? How do you coach on that? How do you get dentists to stop thinking for their patients when it comes to finances?
It's a massive mindset piece for sure. And you really have to train yourself to not judge a situation and standardize everything. Okay. Everybody has to be treated the same way. It doesn't matter if they're walking in dripping in designer gear or, 10 years ago, fashion. It doesn't matter. You have to treat everybody the same. I remember two of the biggest clients we had when I was in clinic spent thousands, and literally you would, spoke with a very soft voice, didn't come in fancy gear or anything like that at all. So never, ever assume. And again, we can impart our beliefs, and it comes back to mindset. I'm fascinated by anything to do with mindset, but we need to be very mindful of not imparting our financial beliefs or whatever it is onto a patient.
Sure.
Because that's not giving them a fair chance.
Well, people don't know too, right? They don't know. Maybe the patient doesn't have the resources, but a family member does. So I received a phone call from a family member years ago who was in some pain and needed some treatment and said, hey, can I borrow? I think they said, can I borrow or can I have? I don't remember, but I took care of it, right? And I was fortunate to be able to do that. But if the dentist was going specifically off of their resources, they might not have presented that treatment whatsoever. And by the way, in that case, it took the person out of pain and improved their quality of life. It was worth every penny to me and to the patient. What are some other things that you see that dentists are doing that are getting in the way of them asking for a patient to accept a treatment or the patient accepting it?
It's a bit of a journey, isn't it? The whole patient acceptance piece. So it obviously doesn't just start when the patient sits in the chair. I mean, it really starts at what they see online. So one of the things I really encourage dentists to do, and I'd love to see more of it, is before and after photos. And it's interesting now, social media has gotten so clever it's not about demographics anymore. It's like about psychographics. Like they have to uncover what are a patient's beliefs, what are their thoughts, what are their behaviors. Like if somebody's thinking, I'm too old for Invisalign, I'm spending the money on the children, but I'm too old to get it myself. Like your marketing, your social media needs to have that message. And if you can get that out there, patients will come to these dentists telling them what they want. So the dentist will save them having to have these awkward conversations of, to risk insulting somebody. So that's the power of marketing. So a lot of dentists I know aren't keen on that marketing because they're booked up for weeks in advance, and I totally understand that. But it's about attracting the right patient and the right work, who's coming in with a positive attitude. They're trusting you because they've seen what you've put up online through before and afters. You have that social proof, perhaps from testimonials. And they're just really coming in, asking for the work rather than needing convincing, arguing with Dr. Google.
Right.
So that's something I would love to see. Yeah, I'd love to see more of. Just people getting a little bit more, I suppose, strategic with the marketing efforts. There's a strategy behind it, like there really is.
Yeah, the social proof is so important. There's a big difference between telling a patient that they're going to like the way they look afterwards, or they're going to love their smile, and them telling the patient that your friends and family are going to love your smile. Huge, huge difference. A little subtly, but huge difference. I don't know if I shared this on the podcast just a few days ago. And if I did, I apologize to our listeners to repeat something. That's how old I am. I just start repeating stuff now that I just said. But if I didn't, the Listerine actually coined the term always a bridesmaid, never a bride. It's actually Listerine came up with that. And basically it was peer pressure. Like, hey, this is how you're being seen by men. In this case, it was a picture of a woman catching a bouquet, I think, or one going over her head was the ad copy, I believe, or the graphics. But that's literally what they did was social proof, right? Is basically they used how people feel and peers to get people to use mouthwash. The number one reason why people brush their teeth is because of the people that they're around, right? They don't want to have bad breath. It's not their actual health. It's about the people that they're around. Literally, if people lived in caves and had access to a toothbrush, they probably would have no need to use it because nobody was around. On your website, you can go check it out. You've got training programs there. Tell us, how do dentists engage with you if they want to learn more about coaching and how you can help? What is that process like?
Sure. I actually do run webinars. I've one on this Thursday. It's a little bit of short notice. I don't know when this is going live, but it's at 7 p.m. in GMT time. And it's basically about really the psychographics and how to do that social proof. But I run them from time to time. But you'll see a lot on my Instagram. It's nice and easy. Lisa Grogan Dental Coach. Same as the website. Or just keep an eye on the website as well. But Instagram is probably the most updated. That and LinkedIn.
Awesome. We'll post links to those on our website and, of course, on our social media as well. Lisa Grogan, dentalcoach.com. Lisa, anything else you want to share with our audience before you go?
I will also share the link with you for the smile assessment form. Guys, if you take one thing from this podcast is please introduce that free little resource. It'll increase your relationships with your patients because you'll be asking better questions and really uncovering what a patient wants, your reputation and your revenue. I promise you'll see a big increase. It's a lovely,
Where can they get that?
I will send you the link for that. It's on my website under the research section, but I'll send it to you as well.
Awesome. Yeah, we'll make sure we post it. Lisa, thank you so much for coming on and sharing with us today.
It's been a pleasure. Thank you.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.